Any department heads on the phone?
No public comment.
Okay.
Oh.
Okay, we ready? Okay, good morning and welcome to the Tuesday, August 18th, 2020 Todd County Board of Commissioners meeting. We will have several people attending in person. Will be Sheriff Ock, Lauren Feldbaum, Adam Ossifer, Jackie Ock, Rick Utek, Sarah Ogren, Denise Gaida, Chris Pilzer. All commissioners are present, and I believe the media is on the phone. Am I correct? There's no other people, so. And welcome to the public that are viewing us live this morning. So please stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, is there any amendments or corrections to the agenda?
Mr. Chair, I have one amendment.
You don't have a microphone and we aren't hearing you very good, so.
Mr. Chair, I have one amendment, and that is to set a date with Morrison County representatives to discuss the Lake Chaminade issue.
We'll put that at 9.4 then. Was there anything else?
No, Mr. Chair.
We do want to move 6.2 and 6.3 up to the potential consent items. Unless Lauren had any comments to make about that.
They're just standard
Yeah,
resignations.
so we'll move 6.2 and 6.3 up to consent items. Anything else? If not, is there a motion to amend the corrected agenda?
So moved.
Motion by Commissioner Kenizel, is there a second?
Second.
Second by Commissioner Becker. Discussion? If not, all's in favor say aye.
Aye.
Opposed? Carried. Okay. Consent items.
Potential consent items today are meeting minute approval, August 4th, 2020. Resignation, Dan Gaida, Correctional Officer, 8/19/2020. Resignation, Nursing Supervisor, 9/30/2020, along with the resignation of Summer Help, Sam Byers, and resignation of Summer Help, Jaden Evanson? Thank you for correcting.
Okay, is there a motion?
So moved.
Motion by Commissioner Erickson, is there a second?
Second.
Second by Commissioner Newman, discussion? Not, all's in favor say aye.
Aye.
Carried, thank you. County Auditor Treasurer.
First item I have today is the Commissioner warrants. Background is sent for your review. Recommendation is the Todd County Board of Commissioners approve the following by motion: to approve the Commissioner warrants with an ACH and a regular manual payment totaling in the amount of $88,474.54.
Okay, you've heard the board action. Is there a motion?
So moved.
Motion by Commissioner Newman, is there a second?
Second.
Second by Commissioner Becker, discussion? Not, roll call please.
Commissioner Newman,
Yes.
Commissioner Becker,
Yes.
Commissioner Erickson,
Yes.
Commissioner Kenizel,
Yes.
Commissioner Kircher.
Yes.
The next item I have is the Health and Human Service Commissioner warrants. Again, background was sent for your review. Recommendation is to approve the Health and Human Service Commissioner warrants with an ACH and a regular manual payment totaling in the amount of $88,325.29.
Okay, you've heard the board action, is there a motion?
So moved.
Motion by Commissioner Erickson, is there a second?
Second.
Second by Commissioner Kenizel, discussion? Roll call?
Commissioner Erickson,
Yes.
Commissioner Kenizel,
Yes.
Commissioner Newman,
Yes.
Commissioner Becker,
Yes.
Commissioner Kircher.
Yes.
The next item is the Health and Human Service SSIS warrants. Background is sent for your review. Recommendation is to approve the Health and Human Service SSIS warrant with an ACH and a regular manual payment totaling in the amount of $74,890.22.
Okay, you've heard the board action. Is there a motion?
So moved.
Motion by Commissioner Newman. Is there a second?
Second.
Second by Commissioner Becker. Discussion? Not, roll call, please.
Commissioner Newman?
Yes.
Commissioner Becker?
Yes.
Commissioner Erickson?
Yes.
Commissioner Kneisel?
Yes.
Commissioner Kircher?
Yes.
The last item I have then is the CARES Act Consulting Services via Clifton Larson Allen LLP. Background is Todd County is currently working through the implementation and reporting requirements related to the CARES Act funds. Todd County has collaborated with Clifton Larson Allen to formulate an engagement agreement to provide guidance assistance regarding CARES Act supporting documentation and related supporting requirements. These services may be utilized as an on-need basis and is eligible for the reimbursement via the CARES Act fund. Our options to approve this and sign the engagement letter or do not approve the signed engagement letter. Recommendation is to authorize the Todd County Auditor Treasurer to sign the engagement letter with Clifton Larson Allen for consulting services related to the CARES Act funds. Implication is not a budget item, again, can be charged back to the CARES Act fund money that we receive, and they're estimating between $3,000 to $5,000.
Just to inform the board, this would, as discussion we had, where did we have discussion on this? Department head meeting. This would help us go through the auditing process a little better with this fund. And they have some people that specialize in proper use of this fund. So it would really help us. So we thought we'd take advantage of that. So just a little background. So is there a motion?
So moved.
Motion by Commissioner Becker. Is there a second?
Second.
Second by Commissioner Newman. Discussion. Not, all those in favor say aye.
Aye.
Carried. Thank you. Public Works, Lauren.
Well, good morning, everyone.
Morning.
Morning.
It's good to be back in front of you, actually in person. Our one item on the agenda this morning is our request for final payment authorization for our federal 2020 H-ship striping contract. This project will include ground and wet reflective stripes and 6-inch latex stripes on various Todd County roads. Our options are to approve the attached resolution or do not approve the attached resolution. And our recommendation at this time is to approve the attached resolution, making final payment of $16,290.72 to Traffic Marking Services Incorporated.
Okay, heard the request and board action. Is there a motion?
So moved.
Motion by Commissioner Kneisel. Is there a second?
Second.
Second by Commissioner Erickson. Discussion. I wish you'd do more of that, so I like that.
We do our best,
I
so, yep, it's a good deal with federals,
Yeah.
the federal government paying 90%, so.
Lasts longer and it's
Yeah,
it's
we
more,
love
it's more
'em.
safety related to me. I
Yeah.
think it's. All right, if there's no more discussion, all those in favor say aye.
Aye.
Carried, thank you.
All right, thank you.
Hey, Mr. Chair?
Yes.
Lauren, before you go?
Yes.
I just want to thank Public Works for taking care of the boat landing out at the park last week. Did an
Oh.
exceptional job. I got a call from Trig Hansen this morning from the DNR in Sauk Rapids. So people are happy out there, and so I appreciate it.
Well, thank you. Their only complaint with us, they didn't get to bring their fishing poles with.
Yeah.
But they had a good day out there. It was a wonderful day, and
Yep.
the water was warm, so it's good we got it done now instead of a month from now, so.
Right.
Thank you. I'll pass that on. Appreciate it.
Appreciate it. Thank you.
Mr. Chair, could I
Yeah.
have a?
Sure.
Say, Lauren, you redid, I believe, County Road 11 where it hits 210, and I think there's been several accidents in the last few weeks, and I think the bumps, or whatever you want to call them, by the stop sign was put in before this weekend. Is there any possibility of getting the double reflective, like what we did on 21 and 210? On
I
some
have-
of those other 210 stopping points?
We have reached out, or a number of people have called regarding that, and I've reached out to MnDOT
Okay,
and talked with their Towards Zero Death coordinator, Tom Nixon, on it, and he is investigating and getting back to us. But ultimately, that stop sign and that control of that intersection is by MnDOT.
okay. And I
Uh,
realized 21 was also in 210.
Yeah,
But it'd be nice because many people made the comment, when we put that double reflective on those
Yeah,
posts.
on the post, yeah.
Yes,
I can
it
reach
just-
out to them and ask if we can just do that as ourselves. Of course, they won't do it themselves, but I'm assuming we can do that pretty cheap, so
Okay.
I'll reach out to them today, let you
Okay,
know what I
thank
find
you.
out. Thank you. Thank
Okay.
you.
Yep,
Thanks.
Thanks, Lauren. Planning and zoning is Adam up.
You have to wipe this desk. I mean, you don't have to, I'm just asking.
Good morning.
Morning.
Morning, Adam.
Okay. Okay, got a few conditional use permit approvals. The first one is for Joseph J. Bontrager.
Move the microphone closer to you, please,
Sure.
Adam, thank you.
An application for conditional use permit to establish a retail greenhouse and sheet metal sales business on parcel 0700-23500 received on May 11th, 2020. This was reviewed by the Planning Commission during the June 4, 2020 meeting and was tabled until the August 6, 2020 meeting. The applicant agreed to tabling this topic and signed the extension. During the August meeting, the Planning Commission developed a recommendation for granting the conditional use permit with the following conditions. Placement of 6 25-mile-per-hour speed limit signs at locations requested by the township at the expense of the business owner. Signs must be placed in accordance with all applicable signage requirements. 2, a one-time donation of $5,000 to Eagle Valley Township for placement of gravel on the access roads to the greenhouse. 3, an annual donation of $2,000 to Eagle Valley Township for the next 10 years for continued road maintenance on access roads to the greenhouse. Review must be conducted by the Planning Commission after 10 years to determine the need for continued donation. This condition lapses in the event of closure of the business. 4, create additional parking space on site to accommodate peak level of business. No parking will be allowed along the roadway nor within the road right-of-way. 5, annual review by the Planning Commission for the next 2 years of operation, followed by a review in the 10th year. 6, the business is limited to a single greenhouse. Additional greenhouses require review of the Planning Commission. The options: motion to approve the conditional use permit with the proposed conditions. Number 2, a motion to deny the conditional use, or 3, remand back to the Planning Commission for further consideration. And the recommendation at this time is motion to grant the conditional use permit on parcel 0700-23500 for establishment of a retail greenhouse and sheet metal business with the proposed conditions.
Yeah, I'd like to have discussion on this before we vote on this. Couple issues that I have is the speed limit, who will post the signs?
The township will install them,
Okay,
and they agreed to that. They said if they buy the signs, we'll work together on placement, and then the township agreed that they will do the installation. There was quite a bit of discussion around the speed limits because there's nothing there to enforce speed. But the intention of them is at least it's something visual to get people to slow down, because right now there's nothing.
no parking, will there be no parking signs on the road?
That was not brought up, so at this point, no. But there was parking on the road because we measured the parking space now, and there's enough for 10 or 12 vehicles. That's not enough. So that's why they're going to take that cornfield to the east of the greenhouse and cut out a big area along the east side there and add a bunch of parking space to accommodate additional parking.
Okay, cause if you got no parking there on the road, nobody knows that, cause there's
Well-
no signs, so.
That is something that could be added as a condition too, somehow here.
I would suggest that because people would
Yeah.
know that if that's in the conditional use permit. And Adam, the other thing is this was an after-the-fact permit.
Correct.
So where's the teeth of this? Where's the fine? Don't we have a fine?
Well, there's the after-the-fact rates that were paid, but there's not a fining process necessarily unless it goes through the entire, that assessment process where it's the 3 letters, comes to you guys.
So they
that
did
sort of-
pay after-fact
Yes.
penalties?
Yep.
Okay,
That's already paid.
okay. Which was how much?
Double the regular fee.
Okay. Okay. Oh, yeah, anybody else? This was the one that Gary and I got a lot of calls on.
Correct. And we spent a lot of time on this one between, well, May and August. lot of discussion with the business owner and the township, and then we actually met on the site, I think it was a week before the August meeting, discussed it as a larger group to try to come to a good consensus as a group of how we can make this move forward, and everybody can kind of be happy, I guess, with the result of it. And then they, without me there, they met again at the actual township meeting with the business owners to have further discussion, and I guess that went really well. And during the planning commission meeting, well, a couple Thursdays ago or whatever it was, the item went really fast. Everybody had their piece to say and agreed that this is a good plan to move forward. The township said this, helps us out a lot, and doing that road maintenance, we'll focus on that road. Their goal is to hopefully do the chloride treatments in the fall, so it's ready in the spring. And they're hoping that continued chloride treatments, that they can just get that road into a good spot where gravel won't be needed down the line. And that's why we put that condition in of after 10 years to see if that continued donation is even viable, because hopefully after 10 years, the road's in a good shape at that point that it won't need that much maintenance.
Okay. And maybe in that time, the business would be done too.
It's hard to say.
Okay, but they did add, was that metal business there before? Was that in addition to that?
That metal business is minimal traffic on the site.
Okay.
It's mostly him making phone calls and directing where to bring the building products. So he orders it up, gets things in place, then they just deliver it directly to the site. And then once the truck is almost empty, they bring whatever's needed to the or the business site then, if anything. So it's minimal vehicle traffic to the site.
Okay. I'm assuming that would involve bigger vehicles.
Yeah, if there's a vehicle coming, it'd be a big truck.
Yeah, okay. Any other questions before is there a motion?
So moved.
Motion by Commissioner Canizzo, is there a second?
Second.
Second by Commissioner Erickson. Any more discussion? If not, all those in favor say aye. Opposed? Carried.
Okay. This is a CUP request from Joseph Kaufman, an application for a conditional use permit to establish a rural schoolhouse on parcel 0700253000 received on June 9th, 2020. This was reviewed by the Planning Commission during the August 6th meeting. After review, the Planning Commission developed a recommendation to approve the request with the following conditions. The schoolhouse must meet all required setbacks as stated in section 9.11 of the Todd County Planning and Zoning Ordinance, or be granted a variance for a reduced setback distance. Number 2, submit an approved plan for septic compliance on the site. The options are a motion to approve the conditional use with the proposed conditions, a motion to deny the conditional use, and 3, remand back to the Planning Commission for further consideration. And the recommendation at this time is granting the conditional use on parcel 0700253000 for establishment of the rural schoolhouse with the proposed conditions.
Okay, you've heard the request, is there a motion?
So moved.
Motion by Commissioner Erickson, is there a second?
Second.
Who was that, Gary?
Yeah.
Second by Commissioner Canizzo. Discussion? I do have one question. Is the Amish exempt from the COVID school regulations? Okay. They're excluded. Okay. Any more discussion? Not, all in favor say aye.
Aye.
Opposed? Carried.
Okay, next. This is a request for CUP from Jeff Kane.
Kane.
Okay. An application for a conditional use permit to establish 4 40 feet by 100 feet sheds for use as commercial mini storage units on parcel 2100200600 was received on June 18th, 2020. This was reviewed by the Planning Commission during the August 6th meeting. The final recommendation from the Planning Commission was to grant the conditional use with no conditions. The options are to approve this conditional use with no conditions, deny the conditional use permit, or remand back to the Planning Commission. And the recommendation is to grant the conditional use on parcel 2100200600 for the establishment of 4 40-foot by 100-foot sheds for commercial and mini storage units with no conditions.
Okay, you've heard the request. Is there a motion?
So moved.
Motion by Commissioner Newman. Is there a second?
Second.
second by Commissioner Becker. Discussion? If not, all's in favor say aye.
Aye.
Opposed, carried.
Okay, the last one, request for CUP from Christine and Todd Tollefson. An application for a conditional use permit to establish a group housing site with greater than 7 residents on parcel 22-0003100 was received on July 14, 2020. This is reviewed by the Planning Commission during the August 6th meeting. The Planning Commission developed a final recommendation of approval of this conditional use with the following conditions. 1, proposed use will be limited to no more than 15 residents total. Expansion beyond this number must be reviewed by the Planning Commission. 2, the on-site septic system must be adequately sized to support the maximum number of residents in the house. And 3, the applicant must abide by all applicable federal, state, and local standards. The options: motion to approve the conditional use with the proposed conditions, a motion to deny the conditional use permit, or 3, remand back to the Planning Commission. And the recommendation at this time is grant the conditional use permit on parcel 22-0003100 for establishment of group housing site of greater than 7 residents with the proposed conditions.
Okay, you've heard the request. Is there a motion?
So moved.
Motion by Commissioner Erickson. Is there a second?
Second.
Second by Commissioner Becker. Discussion?
This is in a rural area, I presume by
Yeah, it's
the,
just west of Staples.
Okay. And you didn't have any other, at the commissioner meeting? I haven't heard, no one's called or said anything, so.
About this particular, no, we haven't received any correspondence related to it. They actually have this sort of business in the city, and they've been looking for quite a while to move it outside to get some space. People can go outside. They have cattle there or whatever. So that's what their intention is, to just to move the existing business into this location.
Okay, any other discussion? If not, all in favor say aye.
Aye.
Aye. Opposed, carried.
Thank you.
Okay.
Sure.
He lost his mask.
Must not, you know, because I never even, until I read this, didn't hear a thing about it, which is, you know,
Have one in each pocket. Unique.
yeah, unique is right.
Are your hands starting to dry out from all that stuff yet? Good morning, Commissioners.
Morning.
All right, I will provide with you, to you today, our update once again. As of August 17th, 2020, Todd County has 435 lab confirmed COVID-19 cases, and again, 2 related deaths. Again, many people are not tested, so the laboratory confirmed cases represent only a portion of the number of people in Todd County who have had positives. Cases no longer needing isolation is 419, which is 96% of our population. And that is calculated out 14 days from their test date, or August 3rd. Male, female, 55% of the population, 241 have been male. Female, 43%, which is 187. 2% unknown, which is 7 individuals. Age range, 1 month to 85.3 years. Case average is 36.9% of the age of population of positivity within Todd County. Total COVID tests performed in Todd County as of 8/13/2020 is 4,726. 474 of those positive tests, 10% positivity rate. Rod did ask for that statistic. I didn't know we had it, but they did find that number for him, so we'll provide that with each update as
So-
well.
A quarter of our residents have been tested roughly?
4,726, right?
A little less, yeah,
So,
okay.
all right, statewide lab confirmed positivity is just over 1 million as of yesterday. 1,023 individuals. Deaths statewide, 1,712. Total hospitalized in the state of Minnesota is 5,886. Currently hospitalized throughout the state is 286, with 155 of those in ICU. Age range for the state is between 20 and 29 years of age. Again, community exposure. We're working closely with the schools I had mentioned last time around our 14-day case average. Right now, the dates that are posted are between July 19th to August 1st, and we're at an 8.18 positivity rate. Our daily rate, we're also giving our schools what our daily rate to kind of give them that trend so they know what to plan for, because the state gives it in 2-week increments. So it's going to help them be able to plan and see when we start going up, to know before the next posting whether they can, so they can plan for their school session, whether they're in hybrid or distance learning. And right now we're at a 6.55 on a daily rate. So. And that will be our next 2-week period once they post it, as well as a 6.55. So again, right now, the dates that are posted for the schools are between July 19th and August 1st. It's 8.18. We anticipate the next 2 weeks will be around 6.55. And that's going to ebb and flow based on our tests that are done and what comes back positive. So that is the update, unless you have any questions for me that I can try to answer for you.
So unless they have a vaccine that kills us, we're gonna have this for a long, long time.
We'll be fighting this for a while. So they're going to really work on immunizing as much of our population with the flu, because that in combination with COVID, they're suspecting could be very fatal to those of high risk or with health problems. We're hoping to have a vaccine soon, but again, there's no date on that. Typically, it's 18 months once they can manufacture and distribute the vaccine from the date of growing it or of the need. So typically, it's an 18 months, which would bring us back into
But-
a while.
But Jackie, this, the flu has been here for how many years? Well, this is really no different than the flu bug. I mean, as far as term, we don't know when it's going to end, and just like the flu, it never ends. It just, it's
Continues, and it
evolving-
changes, and
Yeah, it
right,
mutates
right,
and everything
right.
else. What would be interesting to me, I've seen some of these statistics, is the flu versus COVID, the amount of people had it, who died, what age bracket. It's pretty interesting to see that the flu was actually more dangerous, and some of these, SARS and what was the other ones we had?
Well, they had H1N1,
Yeah,
all of
H1N1,
these.
All
yeah.
those other things, compared to this disease, which I think is overreacted, that's my opinion. But what I seen from the state one day was the number of deaths were 90% of them were in long-term care, which to me means elderly or had real high health risks. So I don't know if that's still true or not with the deaths.
Yes, I don't have that statistic in front of me, but a large population of the deaths throughout the nation is within that population.
Yeah, okay. Yeah,
Okay. Jackie, I had someone ask me.
pull the mic
Oh.
over. Barbie can't hear you.
I had someone ask me the other day about family in nursing homes, and they're getting ill, whatever, their time is getting closer. And what is can we do anything or help them be able to see these people?
That is, those recommendations and directions are coming through coming through MDH, and what they can allow. It is, from what I understand, up to the nursing home administrators of facilities and what their practices are. They're given guidance and recommendation from MDH and how to move forward. There are some restrictions that are put out by MDH, but it's really up to the facility on how they want to proceed with the recommendations. They can do less but not more around visitation and the guidance given from MDH.
So basically, it's individual
It is.
nursing homes.
Mm-hmm.
Okay. Thank you.
Of which most are saying no visitation.
They are.
Or you can visit through a window from the
Yeah,
outside.
which is hard,
Yeah,
you know.
Yeah,
Yeah.
it's not any joke, yeah.
No.
Yeah, it's tough. Steve's dad's in a nursing home, and I think they allow you to visit Monday, Tuesday, Wednesday. And any chance of rain, 40% or greater, they cancel it. So That's almost every day.
So, Mr. Chair, my dad's in the nursing home in Osakis, and we have to schedule a meeting on phone if we want to visit him outside. I know we got in a little trouble because he kept scooting over. He wanted to be closer to us. And it's like, for Christ's sake, it's my dad. You know?
And it's hard when they're reaching out to you. I went and visited my grandma, who's 96 years old and not doing well,
Yeah.
and she wanted to hug us, and
Yeah.
You know.
they
it's-
walked away, and we moved in like vultures. But it's hard. It breaks your heart.
Yeah.
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 It really does.
Because he wants to be out, you know, no, yeah.
Yeah.
Worst thing to me was, visitation is bad too, but when you have a funeral, when we were having funerals for loved ones and you couldn't even have a wake or anything, it was just, that was sad to me because
Can't grieve.
that's,
It's a part of the grieving process.
goodbye, you know, so. Yeah, I know this, I don't know, a lot of issues here, so.
Heart-wrenching.
But yeah, I would just encourage everybody to read up on it. I do a lot of reading on it, and I don't like to harp on Jackie, but if you really want to educate yourself on this thing, truly look at survival rates, mortality rates, things like this. We are being horribly misled.
Yep.
Horribly misled.
I agree.
It's unbelievable when you really start reading on it. And like I said, I'm not gonna preach on it, but educate yourself, because it's crazy.
Yep, I agree. All right, thank you, Jackie,
Great,
appreciate it.
thank you. Absolutely. I'll send Sarah in.
Okay.
Yeah. Absolutely.
Morning,
Good morning.
try and have the mic close to you so people out there can hear you.
Okay,
There,
so today we have a resolution. The Policies Committee has been working to update Personnel Policy Article 7, Section 7.08, the funeral leave bereavement policy. We ask that you either approve the resolution or do not approve the resolution, with the recommendation to approve the resolution.
okay. Any questions before we move forward? I think we saw this at the last work session. so-
Yes.
All right.
I,
Yes, go
just
ahead.
one comment, if I could. We actually put it in the form that it is, in a more of a graph type form instead of all written out. And I think it's easier to read and to understand.
I agree.
Okay, is there a motion?
So move.
Motion by Commissioner Becker, is there a second?
Second.
Second by Commissioner Erickson, any more discussion? If not, all in favor say aye.
Aye.
Opposed, carried, thank you.
Thank you.
It's amazing how fast they go through here and how much discussion we have.
Go ahead.
Mr. Chair, I have a board action this morning to set a per diem amount for the Small Business Relief Grant Review Committee. The background on this was on August 4th, the Todd County Board of Commissioners approved the CARES Act, CARES CRF Small Business Relief Grant Program, and applications for this program are being accepted through August 28th. A committee has been established to review the applications. The commissioners requested a per diem be established for the committee members' participation. The options are to approve a per diem of $35 per meeting for Small Business Relief Grant Program committee members, excluding Todd County Development Corporation Executive Director and County Coordinator, or to not approve, and the recommendation is to approve the per diem.
Okay, I just popped into my head here, mileage for these people? We usually pay per diem plus mileage, don't we?
We can certainly add that. That's not something we
I
discussed,
mean,
but we
it's
can
probably
add
not
it.
a lot of huge figure, but I just thought they gotta drive to get there wherever you're gonna do, so
Yep, we can add that.
can we add
That's-
mileage? At the federal rate, right?
Mr. Chair, during this discussion before, I actually abstain from voting to bring it forward. Should I be abstaining
No, this is
on
a different,
this?
no,
This is,
this is a different issue.
okay.
All right, so, any more discussion? I just thought we should add that, so,
Mr. Chair, if I could just add that this will be, the funding source for this will be the CARES Act
yeah.
Yeah.
dollars.
Is everyone okay with the $35? What our standard per diem for commissioners, is that what our standard is for other committees?
Most of our committees are $35,
Okay,
yes.
that's what I want to know. All right. Okay, then do anyone want to make a motion? Does anyone?
So moved.
Motion by Commissioner Kenizel. I gotta find this on my okay, is there a second?
Second.
Second by Commissioner Newman. Discussion? If not, all those in favor say aye.
Aye.
Opposed? Carried.
Thank you. The next board action I have is just our continued discussion regarding the CARES Act funds. Just an update on where we are at. We just finished our first week of actually having the application out for the Small Business Relief Grant Program. So that's out there. We are advertising through the local papers. We are advertising on our website and also through Facebook. There is some discussion, Rick and I have discussed maybe putting this out on the radio station just to get some more advertising out. We are going to also be sending the application out via email to all of the licensed establishments, so that should get more of a reach. But it was sent out through a press release through the local chamber, which that group reaches about 50 different entities. So we feel like we've got a pretty good reach, but we will continue to see how the applications come in and do more advertising or potentially extend that date if the board wishes, if we don't get a huge response. But I will turn this over to Rick so he can kind of share what he's received and what he's handed out.
If I may, I listened to is it Kick FM on Alec? And I've heard their executive director over there for their economic development advertisement on the radio. It was really a good advertisement. It caught my ear. And so I was thinking, well, that's something you should do, Rick. Both, I think, KUL and Kick FM, because a lot of people, and what's the other one in Little Falls? That's where they listen. Yeah, so I would do, I just suggest, Rick, that you would do that, then people are hearing it on the radio and whatever, so I don't know.
I would also suggest the Wadena
Yeah,
station.
is there one up there?
Yeah.
I got told that the other night.
Okay.
Applications, what I've, good, this up here. Applications we've passed out within the office, about 29 so far. And then I've actually emailed 4 of them. So it's a total of 33. I don't know how many applications have been pulled off the county website or other sources. So it gives me an indication of 33 so far through our office on the applications. We only have 3 in right now. But I mean, I expected the first week to be real slow because we did do a 3-week application process. So a lot of people wait till the last minute to get them in, but I think we'll start seeing them come in this week here for that.
Okay.
It's a matter of people just trying to gather the information, put it down in the application. But any other questions or?
Nope.
No, thank you.
And Mr. Chair, just a little bit of more of an update on what's taking place. We are having meetings starting to take place regarding the small committee groups that were set up, and some of you have already taken part in some of those, and some of you will be contacted to start meeting if you haven't already. But I'm expecting that either at the next board meeting or the second board meeting in September, we'll have some activity and some things to move on.
Okay, good. Any questions? Thank you, guys.
Thank you.
Okay, the next item is we will go into, I'm sorry, Lake Shamana, forgot that, 9.4, sorry.
So, Mr. Chair, I have had some discussions with the Morrison County Administrator. Morrison County is working on a small project to assist Lake Shamana in their water issue, and She is requesting, the Morrison County Administrator is requesting a meeting with our board. It would be the Morrison County Administrator, the Commissioner from District 1, and also the County Engineer to meet with us, and we are just trying to pick a date for that meeting to take place. Their board meetings run in conjunction with our board meetings, and they actually meet every Tuesday morning because they're going through their budget process. So she is requesting that if we do want to meet on a Tuesday, it would be in the afternoon, or we can pick another time. And I would request that we actually choose 2 dates today, so we can pass that back to them to pick.
And how soon do we need to do this?
They're requesting as soon as we can.
Okay. And we are at 18th.
8 board members, Barb? Sure.
Is there
Mainly,
any certain day that's better than? I know the meetings lately have been just,
I have next Tuesday clear. I don't know what you guys have.
25th?
And Mr. Chair, if we look at next Tuesday, it would be an afternoon,
'Cause
because
meet-
they
Say the
meet every
25th?
Tuesday morning.
Okay, so they meet every Tuesday?
Every Tuesday morning, yep.
So, Mr. Chair,
Yeah.
would we meet here or there?
We would be meeting here.
Okay,
They would come to us.
okay.
and then you would have Nancy and Lou involved in this
Yes.
meeting also.
What's the 28th look like, guys?
I'll be gone.
Bad.
Okay, took care of that.
Should we try Tuesday?
25th?
Afternoon then.
Tuesday afternoon?
Yeah.
We can have one date of Tuesday, August 25th.
What time? 1?
Yeah,
We can try for 1.
And then,
right.
Or we better off to do it later in the afternoon at 3 or something?
doesn't matter to me.
I'd prefer the earlier.
The earlier the one? Okay.
Mr. Chair, can I suggest, is there any opening for the 27th? Anytime, morning or afternoon, just to
We
have a
that
second date?
EOC in the morning, don't we?
Yeah, I have Friendly Rider at 9.
You mean as a second date? Is that what you're
Mhm.
saying?
Yeah. As a second
Monday,
date.
the 24th.
We're here, we have personnel on
We could
Monday
do,
morning.
10.
so we
Mr.
could do
Chair,
10.
Commissioner Newman, you have a CPT meeting.
Okay, I thought, yeah, you're right. It is 4th, yeah.
Can I just clarify, is this going to be a work session scheduled or a
I'm sorry,
special
this is
se-
going to be a work session.
Work session.
Mhm.
31st, no, I can't. I'd have to do afternoon. How about the 8th? That'd be the day after Labor Day, and it'd be afternoon, right?
The Tuesday.
Yep. They meet.
I might not be here.
Mr. Chair, how about the 4th, September 4th?
I am gonna be gone that week,
Okay.
so, except for I'll be here for the board meeting, and then I'm gone.
How about the board, do we have a board meeting September 1st?
Yes, yes.
We do.
Is that when you're gonna be gone?
I'm gonna leave right after the board
Okay.
meeting.
And did we already say the 31st is not?
I can't in the morning. I have doctor's appointment in St. Cloud, so and I can't cancel that, so. Could in the afternoon, but
Okay.
I could in the afternoon too.
31st.
Yeah,
Yeah.
we could do the afternoon.
It would have to be 3 because I have a doctor's, wait, I better check to see what time my doctor's appointment is. Three o'clock would probably be better in the afternoon. I
Okay.
Okay.
have to be in St. Cloud and I don't know what time I'll be done, so.
Does that work for you, Rod? or not?
31st?
Yeah.
3 PM.
Or that's our backup one?
Yep. I will take those 2 dates and present those to the administrator from Morrison County, and hopefully we'll get one of those set.
Okay, and then we do have enough time to post each one, so.
Yep.
right, so, okay,
In the afternoon?
Yes.
all right. Any more discussion on that?
Nope, thank
Okay.
you.
All right, then we have a closed session. We will go into closed session. The commissioners will hold a closed session pursuant to Minnesota statutes, section 13D.05, subdivision 3B, attorney-client privilege regarding a pending arbitration matter with ASME Council 65. Is there a motion to go into a closed session?
So moved.
Motion by Commissioner Newman. Is there a second?
Second.
Second by Commissioner Kneisel. All those in favor say aye.
Go, what's the issue here?
Welcome to the Broadworks Collaboration Center. Please enter
They're done with closed session and going back to open session. Thanks, and bye-bye.
Masked man. It's bad. I was gonna say, he's got a radio voice, not a TV face.
Well, tell him. Poor guy. Rick? Rick, Gary's giving the lip to you. You better, yeah.
I said you got a radio voice, not a TV face.
Payback's gonna be something.
I contacted them. Christie said, okay, thank you.
Are you ready? All right, I'll call the regular session of August 18th back to order from the closed session. And I believe the administrator has a, what time is it? I should say that too. 10:16 a.m. We'll call the meeting back to order. And the coordinator has a board action to read in regards to this closed session.
Mr. Chair, I have a board action this morning to authorize a separation agreement with employee number 817. The background for this is an agreement has been drafted for separation of employment with employee number 817. The agreement would pay out a lump sum payment of $10,000. These payments would be in consideration of waiving all claims and potential claims. The options are to authorize the agreement to be signed by the chair and the coordinator, or to not authorize the agreement, and the recommendation is to authorize the agreement to be signed by the chair and the coordinator.
All right, you've heard the board action. Is there a motion? Is there a motion?
So moved.
Motion by Commissioner Erickson. Is there a second?
I'll second it.
Second by Commissioner Kneisel. Any more discussion? I think I'll just make the statement, the commissioners have discussed this thoroughly. It's not to our satisfaction that we want to do this, but in the long run, we are being advised that we are saving money by making this settlement with this employee to put an end to this situation and move forward, so. Just again, the commissioners are not happy about this, but it's something we think we can do to save the taxpayer some money in regards to avoiding a lawsuit or any other litigation, so. All those in favor say aye.
Aye.
Opposed? Carried. Thank you.
Thank you.
All right. Any reports?
I would like to report on the election, since we just had a state primary. Out of 13,348 registered voters at 7 a.m., we accepted 480 absentee ballots. 606 were actually issued. And our overall turnout voting was 2,592, which was 19.4% of Todd County voter turnout, which is typically, or we can actually say doubled from our typical primary.
Really?
So we're anticipating that number to grow in the general election, and we've already have over 700 requests for absentee voting in the general.
Still sad, though. We should have a better turnout for,
We should, but
You know.
I think that's a great turnout for even COVID times. I mean, to double our,
but people need to vote.
yes, they do.
Okay, anything else?
Mr. Chair, just a
Yes.
question in regards to that. Being you have to vote a straight ticket in those primaries, does it tell you how much each one is by?
I don't have that broke down on this
But-
report, yeah.
Okay, I just was
But that
curious.
is-
It's
that's
not
a good question.
important, I just was curious.
Yep.
Yeah.
Good question. Okay. Thank you, commissioners. I think we're all doing our Zoom meetings and everything else that,
Yippee.
I have to announce today, I have my first in-person Great Regional River Library meeting that we can meet in person. But the room is big enough for 15 board members, so she said she's got the table spread out. She doesn't know if we can hear each other, but we're, so,
Take your binoculars.
yeah, so we're having our first face-to-face.
About the size of the expo
Yeah,
building.
so, yeah, so anyway, that's gonna be interesting. So that's our first one, so, but I've really had to be in person. We've been doing our smaller meetings here in person, but we have the room spread out so we can manage that. Coordinator,
I have nothing at this time.
all right, then, we have a motion to adjourn for the month.
So move.
Second.
Motion by Kneisel, second by Commissioner Becker. We are adjourned. Well, I don't know. It's gonna be interesting, because
Hearing
they do not
aids.
have the best microphone system, so. Yeah. There we are, okay.
Oh, do you have, Chair, do you guys have copies
Oh,
of these?
Chris can hand them out. Yep.
Thank you.
I think you put it on email or something, didn't you? I saw it, so.
This,
MRC put it out on there for the 39 counties, I know, Rick, so.
Thank you.
And this is very important. It's, actually, it will determine whether we receive grant money, you know, for, through federal grants, and also state grants helps for our broadband, for putting in fiber internet for residents
Is
within the
this
county.
funding for each county then that you're talking
This,
about?
this funding is for, what we're doing is, the maps currently right now show that even if you have cell service, a hotspot on your cell, it shows it as that you have service.
Oh,
But what we're trying to do is trying to get speed tests for every place in Minnesota, every resident, especially in rural areas. It's really critical that we get that, they do the speed test. We do have it on our website as a pop-up on the top. When you first get on our website, you can click on and get right into it. Basically, you just pop in your address and then take the speed test. And it'll be registered county by county, statewide. But the current, like, as I said before, the current maps that we have out there are so bad that some of the areas that have no internet, they show internet. Or you have telecoms that lay in cable and it's not hooked up, they say, yeah, we're gonna get it. So if we can get everybody within the county to take this test, especially in the rural areas, is ultra important. It'll definitely help our chances of getting dollars for, grant dollars for putting in fiber broadband.
Rick, does that money actually go to the county or to the co-ops, or how does that come back to us, that money? I'm a little confused.
Well, the Rural Minnesota Broadband Coalition is doing this so they can put forward an accurate map.
Yep.
Now, the venues for grant money, which the last one we did was Moran Township, and those were USDA rural development monies, broadband monies, but that was an 85% matching grant. And then
85%?
85% matching, and then CTC kicked in the 15% on that grant to do the Moran Township area. And a lot of the you take the state broadband grant program right now, and they'll do 50%, but where does the other 50% come from? It would have to come from township, the county, or other places, and the money's just not out there to do that. So if we can show that we have areas that really need the broadband, they would qualify better for the federal dollars, especially the 80+% matching dollars out there. And right now, our maps are so convoluted, it doesn't show who are the key areas that really need it.
Okay.
So that's why I encourage everybody. I just brought it in front of the board this morning as information for to get everybody to take this test. Click on, take it. It definitely make a difference.
And how are we marketing this? Are we getting it on we have it on our web, is it on the radio, in the newspapers?
It's on radio, it's on the state website, it's on the Broadband Coalition website. Blind Foundation has it on their website. We have it on our website. And I'm sure with the work session here, it'll get out to the newspapers too, so they can see the value of it.
Mr. Chair, we also are going to be putting it on the Todd County website, so Rick has it on his Development Corporation site. We'll put it on the Todd County website, we'll do Facebook blasts, and we'll also get it out in a press release.
And the cities are doing it, I'm assuming on their websites or links with us or whatever.
I can contact
Yeah. It just, the more people that do this, the better off we are, because
Yes.
we all found out during this COVID, the work-home situation, and we've been preaching to Colin Peterson and all of them that we don't have broadband here, good fiber, you know?
Right.
And now they need proof. Well, I guess our verbal isn't proof, but they now need data. But this work-at-home thing has caused a lot of issues for people because they don't have the speeds to work at home, so.
The kids in school.
Yeah, or school issues, right. So please, take the test. I've given it to my wife, so she has to do it. I ain't gonna do it because I won't know.
Well, thanks for your time, I appreciate
Yeah,
it.
Thank you, Rick. Any
Thank you.
questions? Okay, thanks.
Thank you.
Thanks.
Morning.
Good morning again. Good morning. Sam and I have an agenda before you today, are a topic around some evidence-based nursing. Pull up my stuff. So last week, August 12th, Wednesday, we met as a community health board, which again is Morrison Todd Wadena Community Health Board, CHB. And we talked about our evidence-based nursing program, nurse-family partnership that we are currently enrolled with, and exiting that and moving into the maternal early childhood sustained home visiting, which is called MESH. We have learned about MESH, Sam,
about
late spring.
I was gonna say, like, it was about late spring, yeah, springtime, that the state had started having some conversations with local public health about this new evidence-based program that's been implemented in other states. I want to say in like Virginia, it's been kind of trialed, And so they were working on trying to identify, you know, the value of the program. And then throughout the last 6-7 months or so, they've really found true value in the program and now have decided to do like a contract with Mesh through MDH for the next 3 years. So they are fully implementing and supporting the evidence-based program.
So in front of you, we have kind of our business plan, our goals and the outcomes, cost savings, program revenues, our transition plan, and why we are choosing Mesh, as well as we handed out in front of you the kind of the cost that comes along with the business plan. We were on a very shortened timeline as our contract with NFP requires a 60-day out. NFP has been a great program for us. It's been evidence-based. It serves families that have one child, initial child, and they could be enrolled starting up to 28 weeks, right? And then they go until the age of two. So it's been very successful for us, but now in front of us, we have this new evidence-based program, and it's new, but it's still evidence-based, that MDH is supporting. It is being implemented widely across Minnesota and in other states. For us, for Todd County, I want to say it's going to be more cost-effective as well, as the opportunity of serving more mothers and more children, not just moms with their first child. We can open this up for all moms with the children and families. So it's an opportunity to serve more and plus be more cost effective for us, as well as being able to bill for
Yeah, I think there's a lot of advantages because it still provides the evidence-based structure, which allows you to bill at a higher rate if the individual that you're working with is insured. And two, the beauty of the program is that you don't need to necessarily catch them before 28 weeks gestation. So let's say you get a referral from the hospital of a mom, whether it's their first or third child, you're still able to enroll them in the evidence-based program using Mesh, as long as it's within 6 weeks after the birth of the child. So that's kind of a nice added benefit to it.
So last week, Wednesday, we presented and we had quite a lengthy discussion with the commissioners that represent their respective counties, and it was approved by motion to move forward and give NFP our 60-day notice. Now, that agreement is again with Morrison Todd Wadena holding the contract and Cass County participating as well. So we are gonna need to come up with another contract. So we ended the contract, we're gonna be sending in our 60-day notice with NFP, and then end the contract with Cass County to sign a contract with MASH, again, the Maternal Early Childhood Sustained Home Visiting. So before we send staff to training, which is local and not in Denver now as it was in NFP, again, that'll be a cost savings for us, and we're gonna be able to send all of our nurses and not just one nurse that had been working just with a nurse-family partnership. We wanted to bring that in front of you for some discussion and awareness that our nursing staff will be training for a new program. And we'll be moving forward with that.
Well, if I may, we had a lot of discussion as commissioners on this, in particular Morrison and Todd. I love the other program because it was touching parents and one child in the family. Because of the payback of per dollar, I think it was 6 to 1, and so I was very supportive of that, and in hopes of cutting down this revolving door of welfare and jail and all this other stuff that goes on with these some of these parents and children. This one, I think, I'm very excited about. I said early on in the meeting that it will touch more children in the families, which I think the payback will be better than 6 to 1. Myself, I'm looking at that. I'm hoping we get some data to show that down the road. Do we have any data from the family nurse partnership that we can show that now we're ending with them? Do we have any data we
We
can?
can,
So I'll work with
Go
Lisa, who is the reflective supervisor in Morrison County, to try to pull some of that localized data.
Okay.
I don't know that we'll be able to necessarily get like the return on investment information, but what we could get is some of the rates. Like, for example, they track immunization rates of
Yeah.
the children that have been enrolled with Nurse Family Partnership, or breastfeeding success rates and length and duration. Some of those data points we could collect and then either bring to another work session at some point in time, kind of a wrap up of.
I think in the long run too, my thoughts are, and I think I made this statement, that maybe the child protection issues would decrease also because of some coaching and teaching on parenting and things like that for these children, and maybe improving their health and, as you said, immunizations and stuff.
Yep.
But in hopes to cut back on child protection issues would be a great impact on the county. So, and to keep them out of jail would be another big impact for our county if we can do that. So, I am supportive of this, so I'm just sharing that with the board. So,
Mr. Chair,
yes,
have pregnancies went up since the COVID started?
Well, we haven't necessarily, I don't know that, I haven't looked at birth rates, so I can't answer that directly. I can follow back up with you on just what they are right now, but I would assume we would probably see an increase. If we do, probably not quite yet.
Okay.
That's an assumption. I can follow back up
When
with
he
you.
shut down for a month,
are we gonna title them COVID babies then?
We all know maybe about 9 months or so from March, we may see that increase potentially.
Mr. Chair.
Yeah,
Mr.
Okay,
Chair,
Gary asked first.
It's, you can contact the mother after up to 8 weeks after the baby's born. How far do you follow the child through? Because the other one was you had to quit at
2 years.
2 years. yeah.
Yep, so this is the same length of a program, so you would follow them with this structured evidence-based program until 2 years of age. We intend to, I believe at this point, continue with our traditional family home visiting as well. So when you have those families that may, for some reason, not meet the specifications of mesh, which are much broader than NFP, so I don't think we'll have a whole lot of those families. But for example, if you have a family that has a 3-year-old or a 2.5-year-old that's still needing some development support or guidance, then we would just roll them back into our traditional family home visiting program to continue providing that support.
Barb?
Correct me
Okay.
if I'm wrong, Jackie. Yep, nope, you're right.
on your
Okay.
chart here, you've got July visits 39, and enhanced rate is 26. Is that would be added to the 39?
Yep, so when looking at our current NFP caseload, that's how many
Yep.
visits we had for the month of July. Then we looked at our traditional family home visiting staff currently and went through the caseload and identified that there would have been, now this is, not all families have insurance, right? So not all are billable visits, but assuming that they were billable, there would have been 26 additional visits that we could have billed under the evidence-based rate that would have fallen into the mesh program.
Do we have enough labor nurses to handle the additional visits?
Yep, so they're already providing the visits, but more in a traditional family home visiting aspect. So then now, instead of enrolling them with traditional family home visiting, they would just enroll them with the mesh model.
Okay, and how are you doing that during this COVID time?
Telehealth.
Okay.
A lot of the visits are being done remotely. There are some families that's maybe it worked well initially, maybe it's, there have been some situations where face-to-face visits have been completed outdoors, and implementing that social distancing, but most of the visits are happening telehealth or remote.
Probably not the most desirable, because you're not having that face-to-face, you can't see what's going on in the home.
Yeah, I think a lot of the families definitely miss that personal interaction. I mean, I know it's nice to be able to at least have a face to a visit, but it's not quite the same.
Right.
And the children, of course, I've had some reports of even like when they have had the face-to-face visits, it is challenging because the kids are so comfortable and used to seeing these nurses that they want to run up and hug you and everything else. So
Yeah.
hopefully we can get back to that.
Okay.
Anything else, commissioners? You will bring it back. Do you have to bring it back to us then? Is that
Yeah.
correct?
No,
'Cause
well,
our
it's
board-
approved by the
okay,
CHB,
okay.
and that's where the contract is held. We wanted to be sure to
Yep, this is
circle
just
back around with you to let them, let
Information.
you all know.
Okay, thank you, guys.
Thank you.
Randy, I believe you have the next topic, is that correct, or
yeah,
Chris?
kind of both of us, and Gary.
Okay. Yep.
Okay, this is a survey that Otter Tail County had sent out and asked the residents to fill in. And we would like to see a survey done since we had really good success with the COVID one. I know there's 23 questions on this one, but I've had constituents ask me, how many haulers do we have that recycle? And I couldn't answer that question. I think we need to do a survey and get the questions out there, and see what the response is gonna be.
Did Otter Tail send this out already?
Mr. Chair, they did send this out, and they had 600 and some responses. They had it out for 3 weeks.
Okay. Which is of what percentage? Do we know?
I'm not quite sure what the percentage is.
57,000 people.
Does this go to the cities or just rural?
I think both. They were handing them out.
Yeah,
Also at their solid waste facilities, so.
Yep, so they did a handout to get people to go out and complete the survey, and, I mean, they really publicized it. That sounds a little low on a turnout
Yeah.
on a survey, so I would hope that we would have, as good of response as what we had with our earlier survey that we did. In reading through this survey information, I think there's a lot of really good questions that could help us in what does the public really want for recycling, and what does the public expect for disposal, and what areas of education are they looking for as far as solid waste. So a lot of these questions are just really good questions that could help us overall with solid waste. It might be a bit much to do all of these questions on one survey, because I know myself, if I have too many questions, I'm not gonna complete
Not
it.
gonna
So
do
I
the
think
survey.
trimming it down would be maybe a good idea.
Yeah, I suggested 10, I think it was.
How would you whittle that down? Who would,
I thought if you guys just take this home with you and then mark out your top 10 and,
bring it back and then have it on the next board meeting?
yep.
Okay. Okay,
Mr. Chair, can I ask that when you have those top 10 developed, if you want to maybe just send them to me and I can collect those responses for the board meeting?
yep, okay.
Mr. Chair, Chris, do we ever hear anything back from the bonding, or is the state pretty much just shut down? You know, do you ever hear anything?
I actually did just take a look at that, expecting a question about it. I did take a look at that, and there is a potential discussion with their September meeting that they're going to be coming back into session. They're hopeful that something may get passed either in their first meeting or their second meeting of September.
That's session number 4.
Yeah.
Could be.
How many million per session?
So
Okay.
that's what I know right now.
Bless their hearts, they're working. Okay. Anything else? If not, the work session ends, and have a good week, I guess.
Thank you.
Good Labor Day. Have a nice Labor Day. I guess we will have a meeting before then, won't we?
Yeah, we'll see you maybe before.
I'm a little